All right, I put this on YouTube too, so if you need to go back and review these, you can. They'll be on YouTube. Hypoglossus. Hypoglossus. It tells you where it's at. Hypo is below the tongue. So hypoglossus originates on the upper border of the greater horn of the hyoid. Hypoglossid or hyoglossid. Goes from the hyoid bone upwards. So it's hypo is below the tongue, but it's also attached to the hyoid bone. So you can look at it both ways on that one, but it's really gets its name from the hyoid bone, hypoglossus. And it inserts on to the intrinsic muscle of the tongue. In other words, the muscle itself, the tongue itself, on the bottom. Depresses the tongue on the sides and retracts the tongue back. Okay, so this one won't help you curl your tongue. It will help keep you so that you can't curl your tongue. It keeps your tongue in place. Sternocleidomastoid. Ooh, big word. Sternocleidomastoid. To break it down, we sternum, clavicle, mastoid. Those three places is where it attaches. Sternum, clavicle, mastoid. Really important muscle for turning your head. So it originates on the sternal head. We have two different parts of it. The anterior surface of the manubrium, or the mandible, excuse me. No, manubrium. I have that right. The clavicle head goes from the medial 1/3 of the clavicle and inserts on the mastoid process of the temporal bone. So when it contracts, it'll turn your head to the opposite side that it's on. So if your right one will contract, it goes from the clavicle up to the mastoid. It will turn your head to the opposite side, to the left. The right one contracts, it goes to the left. If both of them contract, you bring your head forward. Brings your head down. The spinal accessory nerves is the one that does that, and the carotid artery is below that. So you always see people on TV, they just cut the neck, you know, and people bleed all over the place. You have to go through this muscle to get to the carotid artery. So you better have a pretty sharp knife. So in order to cut somebody like that, you'd have to go through the epidermis, the dermis, any fat that's there, through the sternocleidomastoid muscle, any other structures that are covering that, but it's doable. Some of these muscles, the semispinalis muscles, are long muscles that go up and down the spine. Semispinalis, spinal. As you see spine in that word. So it originates on the transverse processes of the 7th cervical to the 12th thoracic vertebrae. It has different parts. We have the capitis, which is the very top. We have some that come from the cervicals and the thoracics that goes down to the side. And these extend the trunk and laterally bend them. So this is your back muscles. So when you do sit-ups, you should also do back-ups. You should exercise your back muscles and strengthen them. If you strengthen just your stomach muscles all the time, you're going to start being pulled forward and it's not going to balance out your system. Balance is what the body likes, so you have to do that.
So how would you exercise this?
You lay on the floor, try to pick your shoulders up off your planking, and all that stuff helps too. So there's three parts. There's the capitis, cervicalis, and the thoracicus of the semispinalis. Splenius capitis. It's another small little muscle. Originates on the ligament of nuchae and C7 to C6 vertebrae and inserts on the mastoid process. So if both sides contract, it pulls your head backwards. If you contract one, it pulls your head backwards and down. Backwards and inferior on the same side. Okay. Longissimus, another back muscle. Goes up and down the spine. Originates on the transverse processes at the inferior vertebral levels. Okay, so it's basically goes from one vertebrae to another. So Like if you were on T5. It originates on T5 and inserts on T4. Okay, so they help bring each vertebrae backwards, extends the back. Rectus abdominis. This is part of your abdominal training mechanisms, your sit-ups. Rectus abdominis gives you the six packs that you want. It originates from the pubis and the pubic symphysis all the way up to the xiphoid process. It flexes the trunk, gives you that ripple effect on your stomach, and it creates this sheath across the abdominals. They're kind of like a connective tissue between the muscle parts. We call this an aponeurosis, and it gives you that separation of the muscle. It makes it look so nice and tight. Another back muscle is a quadratus lumborum. Helps with the back. Originates on the posterior part of the iliac crest. The gluteus goes down. This one goes up. This one goes superior from the iliac crest. Inserts on the transverse process of the lumbar vertebrae. It can laterally bend the trunk sideways, and if both of them contracts, you extend the back. It's a very strong, powerful muscle. It helps to keep you upright. Erector spinae. This is the rest of the muscle. So when we look at the longissimus and the different muscles, the spinalis muscles, they come in layers on the back. We don't have these big, strong muscles in the stomach. We have smaller muscles that extend the full length of the spine. So this one goes from the iliac crest, the sacrum, up to the angles of the ribs, clear up to the skull. Erector spinae. This is the one along with those others, this is the back muscles that keep your back in line. If you don't have strong back muscles, then you have problems. You can have disc problems, all sorts of different things as you go through. It helps. This is what's the ones you want to work with when you're trying to lift properly. Make sure that you have the right technique. Iliocostalis muscles originates on the iliac crest and the sacrum, and it inserts on the angles of the ribs. It's more on the back muscles all at the same time. Spinalis, another small muscle in the lower back, middle back, goes all the way up from the inferior vertebral levels, inserts on the spinous process of the superior vertebral levels, clear to the base of the skull. Externally extends the back. Another one that you can see, those others, the back muscle ones, you really can't see and look at too much unless you start dissecting people. But the latissimus dorsi is one that you can see, and it's, if you ever look at swimmers, like Michael Phelps, he comes up from his waist and it looks like he's got this huge sheath in the back of his back. It just comes right up to his shoulders. And that's latissimus dorsi. Pull downs, lat pulls, swimming will develop your latissimus dorsi tremendously. Swimmers have these big lats, and you can tell a swimmer from that. So it originates on the spinous process of T7 to the sacrum, all the way down to the bottom, and then inserts on the floor of the intratubercular groove. Where's the intratubercular groove at? Intratubercular groove. Does anybody remember the humerus? That's where it sits, right on that area. So it goes all the way up, goes over the top of the shoulder into that groove. Very powerful muscle for swimming. Deltoid. This is actually three muscles built into one. Most people only work out their deltoid in one direction in one of these areas, but you can do 3 different exercises for them. Originates on the lateral 1/3 of the clavicle, acromion, and the lower lip of the crest of the spine of the scapula. It inserts then in the deltoid tuberosity of the humerus, down in here. And when you can bring it forward, straight out, or slightly posterior. So they have 3 different aspects that you can work with out. It abducts the arm, but in order to get it, it only works about 20 degrees out, and then the deltoid kicks in. The subscapularis does most of the work at that beginning point. But it abducts the arm. What kind of exercises would you do for this? What kind of exercise would you do for the deltoid? Anybody work out?
Races,
What's that?
lateral races.
Yep. Butterflies, those types of things will do that too, to a certain degree. Supraspinatus. Supra, above the spine of the scapula. So that's where it originates. It inserts on the tubercle of the humerus. Tubercle of the humerus. And it initiates the abduction of the arm. So the supraspinatus starts the arm to go outward, and then the deltoid takes off after that. So if you're going to work the deltoid, you don't need to don't bring the weight clear down to your hips. Start it out about 20 degrees, then start pushing it outward, and that will give you the better workout. Infraspinatus is below the spine of the scapula. That's where it originates, and it inserts on the greater tubercle of the humerus. Remember where those are at now? See, that's why we go through the bones first, so that you have an idea where these are hooking onto. It laterally rotates the arm. This is part of what we call the rotator cuff muscles. You ever heard of that? Some people hurt their rotator cuff and have to have a surgery on it. So the infraspinatus, supraspinatus, teres minor, and subscapularis are part of those muscles. Those are all rotator cuff muscles. There's 4 of them. Sits is the way to remember those. Supraspinatus, infraspinatus is SI, T is teres minor, and subscapularis is the S. Sits muscles, all 4 of them. This becomes important for older people. The tendon of these muscles kind of all come together in one spot, and it will get to the point where it becomes brittle, and they can tear it just by doing almost nothing, and they have to have that replaced. It causes lots of problems. Teres major originates on the dorsal surface of the inferior angle of the scapula, that inferior point of the scapula, and inserts then on the crest of the lesser tubercle of the humerus. This one adducts the arm. It pulls the arm inward towards the body. Teres minor, again, that's one of the sits muscles. Originates in the lower aspect of the scapula and inserts then on the greater tubercle of the humerus. This one helps in this rotator cuff as well. Biceps brachii. This is a good one for people to work out. This is a Popeye muscle. Right? This is, you ever watch Popeye? He eats his spinach and his muscles get really big in his arms, right? That's one of my favorite cartoons. It's Popeye. So there's 2 heads to the biceps. That's why they call it the biceps brachii. The first one is short head, goes to the tip of the coracoid process, right here. The long head goes through the bicipital tendon, the bicipital groove, or the intertubercular groove, and it inserts then on the tuberosity of the radius down below. Tuberosity of the radius. So when you're doing biceps, you want to make sure you turn your hand when you're bringing it up. That makes the most efficient work. If you just do this, you're not getting as much work out of it as if you turn the wrist this way. Makes it much more efficient. Powerful supinator of the arm. Brachialis is another one that works just with this, right below the biceps brachii. Originates on the anterior surface of the lower one half of the humerus and inserts on the coronoid process of the ulna. Remember, the coronoid is right where that trochlear notch is, and it comes up. There's a coronoid process. Very powerful flexor also, along with the brachioradialis. These are all three that helps to flex the arm. This one is a smaller muscle. It originates the upper two-thirds of the supracondylar ridge on the humerus and the lateral base of the styloid process of the radius. So it goes all the way down to the bottom. Triceps brachii. Well, if biceps brachii has two heads, this one has three. It's found in the back of the arm. This is the antagonist to the biceps. What is an antagonist?
The opposite.
Does the opposite. So we have an agonist that is a muscle that moves something. The other muscle is an antagonist that moves it backwards. So we have the three heads, and we have inserts on the olecranon process of the ulna. Very powerful in push-ups. Those types of exercises make your triceps huge. Supinator originates on the lateral epicondyle of the humerus and inserts on the lateral aspect of the proximal one-third of the radius. So it's designed to supinate the hand. It rotates the hand from pronation, flat, to upward, so that you can put soup in it, supinator. Pronator teres. This one pronates the hand. It turns it just the opposite of the supinator. Originates on the common flexor tendon, and it inserts then on the midpoint, the lateral side of the radius, the shaft of the radius. Pronates the arm. This is another muscle that's we use a lot, the diaphragm. Every time you breathe, the diaphragm is working. So this one originates in the xiphoid process. Where's the xiphoid process at?
It's right below your sternum.
Right below the sternum, that thing that sticks down, right? Fascia of the quadratus lumborum, the psoas major muscle, all the way to the back. That's why when people have problems with their back being out of place, the quadratus lumborum goes into spasm, it pulls on the diaphragm, and they have a hard time breathing. They don't feel good. They just can't get enough breath. Inserts on the central tendon of the diaphragm. It all comes together, and in the diaphragm there's a hole. Through that hole goes your arteries, your veins, your nerves, goes through that hilus, they call it, and sometimes the stomach also tries to pull back up through there because the esophagus goes through that hole also. So there's this opening that allows for things to get through it. It's like a covering. So it makes it so that you can breathe every time. What helps you breathe too is the external intercostals and the internal intercostals. Two different muscles. Two different muscle groups. The origin of the external ones is the lower border of the rib, and it inserts on the border on the upper rib. Okay? So what this does is it makes the ribs, pulls the rib towards it. So we pull it towards the origin. This is going to pull the ribs downward so you can exhale. The internal intercostals originate on the upper border of the rib and insert on the lower border of the rib above. So they're going to help us breathe also. So we have one that lets us open up the rib cage, the other one compresses the rib cage down. Now most of the time we just breathe, when you're sitting in class, you're using your diaphragm to breathe. But if you want to take a deep breath in, then you have to use your intercostal muscles, your external intercostal muscles or internal intercostal muscles. Rectus abdominis, we already did that one, didn't we? Not do that one again. External obliques. These are muscles along the side of your stomach. Makes it so that you can turn. Helps you rotate your body in different directions. So originates on the lower 8 ribs. Lower 8 ribs. So what ribs were those? Would those be true ribs or false ribs? False ribs, right? Inserts then on the linea alba, the pubic crest, and the tubercle of the and the iliac crest. So all the way from the anterior superior spine all the way up into the iliac crest is where it inserts. So we're pulling it downward. We're going to be pulling so we can, when we do sit-ups, how do you do sit-ups? What's the best way to do a sit-up? Cross your arms. Then how far do you come up? You bend your knees, keep your knees straight. Bend your knees. And how far do you come up then? So you touch your shoulders, your arms with your knees.
I usually go to like mid-thigh.
At the mid-thigh.
Yeah.
So your elbows are hitting your mid-thighs. Okay, so you keep your elbows straight like this or cross?
No, like cross, mid-thighs.
Okay. Do you need to go that far?
No.
You don't have to. One way that they're doing now, a lot of people are doing, is they don't do complete sit-ups like that. They just cross their arms and they just raise their shoulder blades off. Their scapulas off the ground, and then they hold it for the count of 10 or 15. So not only are you doing an isotonic exercise, but you're also finishing it with an isometric exercise. And that helps in 2 different ways. You're kind of cross-training your muscles. So when you're doing an internal and external obliques, you're going to rotate one way and the other way. So you only have to bring the shoulders off and then contract the muscles. Because that's all you're really trying to do is contract the muscles. You're not going to make these huge, but they're going to be strong. Okay. So that's the external obliques. And we have the internal oblique abdominal muscles, which originate on the thoracolumbar fascia, an anterior 2/3 of the iliac crest, and it inserts then on the 2 or 3 ribs, linea alba, and the pubic crest. Okay, so it's going to help us twist, flex, and laterally bend the trunk. Transverse abdominis lies underneath the rest of these. It originates on the lower 6 ribs, the thoracolumbar fascia, anterior 3/4 of the linea crest, iliac crest, and lateral 1/3 of the inguinal ligament, which goes down throughout the body. Inserts in the linea alba and the pubic crest, and it compresses the abdomen. Part of your 6-pack. Helps with the 6-pack muscles also, along with the transverse abdominis and the rectus abdominis. Okay, so muscles of the hand. Most of you have very few muscles of your hand, in your hand itself. From your wrist on out, you don't have very many muscles. Most of what moving your hand is all done by tendons. The only muscles you really have are here in the thumb pads and here underneath the little finger. That's the most muscles. The other muscles are called the lumbricals that move the fingers apart. So you can do the Spock thing, right? Those are the lumbricals. Other than that, most of the muscles are here for gripping, or for really grabbing something, you use the muscles of the forearm. The muscle bellies are here, the tendons go up underneath, and they attach in the fingers. So the flexor carpi radialis. Flexion would be this way, grabbing. Flexor carpi radialis. Originates on the common flexor tendon and the medial epicondyle. All the flexors will attach on the medial epicondyle. Then we have the muscle belly. Then we have a long tendon that goes down to the fingers, or in this case, to the carpals by the radius. The base of the 2nd and 3rd metacarpals. And it flexes the wrist and abducts the hand. So it flexes, in the anatomical position, flexes and abducts the hand this way. Flexor carpi ulnaris. This sits on the other side, so it's going to flex and medially rotate or adduct the hand. Flexor tendon on the lateral aspect of the arm, of the epicondyles, and it inserts on the piriformes and the hook of the hamate. Flexor carpi ulnaris. Extensor carpi radialis longus. So if we're going to flex any muscle, we have to have a muscle that pulls it back. Otherwise, if we just had a flexor carpi ulnaris, it would just keep your hand bent. We have to have the extensor carpi ulnaris to straighten it back out. So it originates on the lateral aspect of the humerus and inserts on the dorsum of the second metacarpal bone, clear down into the wrist. That's the antagonist. Extensor carpi ulnaris, again, is an antagonist of the flexor carpi ulnaris. Does the same opposite direction. Common extensor tendon and the middle 1/3 of the posterior border of the ulna is where it originates, and it courses down the medial side to the base of the fifth metacarpal. Extends and adducts the wrist. Another one is a flexor digitorum profundus. This one goes clear down to the digits, the second and the fifth digits. So we have muscles that go down and they attach to the first set of phalanges. And we have another set that goes down to the next set of phalanges. And finally, the profundus ones, the longest ones, go clear down to the bottom. Clear down to your little fingers. So there's 3 different muscles contracting to make you grip with your hand. They all go underneath here. This is called a retinaculum. And this is where you get the carpal tunnel syndrome. The carpal bones, tunnel, there's a little sheath that goes across, and the tendons go underneath that, and they get really irritated, and they have to have surgery because of it. Flexor digitorum superficialis, another one, flexes the metacarpal phalangeal proximal interphalangeal joints. Wow. All the way down into the hand. Originates on the humeral ulnar head, and it inserts on the shaft of the middle phalanges. Extensor digitorum helps you bring your fingers backwards. We have flexors that make you grip. These help you release so that you can push. Originates on the common extensor tendon and inserts then on the digits 2 through 5 on the fingers. Extensor indices. This is one that makes it so you can move your hand back, your little finger back and forth, or your pointer finger back and forth. Posterior interosseous membrane of the posterior lateral surface of the digital ulna, and it inserts on the tendon of the second phalange of your index finger. Now, going back to the hips, the pectineus muscle, another little muscle that goes from your pubic bone down to your, basically your lesser trochanter. But it adducts, pulls the legs inward, just like the adductor muscles do. It makes it so that you can squeeze your legs together. One of the hamstring muscles is the biceps femoris. Biceps femoris is one of that's important. Where are the hamstrings at? Back of your legs. Quadriceps are in the front, hamstrings are in the back. So we have the biceps femoris, the long head comes down, it originates on the ischial tuberosity. That's where you sit on. And the short head originates from the lip of the linea aspera and inserts then on the fibula in the lateral condyle of the tibia. Goes clear across the joint so that you can flex your knee backwards. Extends the thigh and flex the leg backwards. Hamstrings can be one of those that get pulled when you're running. It can cause lots of damage because they're very powerful muscles. Semimembranosus, another one of the hamstrings. We have the biceps femoris, semitendinosus, semimembranosus, are all part of those hamstring muscles. The origin is the upper outer surface of the ischial tuberosity. That's the bone muscle that you sit on, and it inserts on the medial condyle of the tibia. It extends the thigh and flexes the leg. So when you're running, you extend your hip up, and then you bring your foot back, and that propels you along forward. So if you're running forward, you're going to use your hamstrings. If you're running backwards, you're going to use your quadricep muscles because they're the ones that are pushing you backwards. So if you want a really good workout, don't run just forward, run backwards. That really gets your legs tight, and you'll know the difference the next day. Makes a big difference. We did that when I was in football camp. We make this run 100 yards as fast as we could backwards. I don't know how many times. My legs never hurt so bad in my life. They were just torched. But when I got done, I had huge muscles in my quads. Semitenosis, lower medial surface of the ischial tuberosity, and inserts on the medial surface of the tibia. So it comes around the medial side of the tibia, what we call the pes anseralis. That is the common tendon, basically. It extends the thigh and flexes the leg. That's all they do. Another muscle that helps keep everything together is the gracilis. It originates in the pubic symphysis, inserts on the medial surface of the tibia, and it adducts the thigh. It flexes it, brings it up a little bit, and medially rotates the thigh because it's on the inside of the leg. Sartorius, this is a fun muscle. It's called the Taylor's muscle. That's the name for it. I'm going to write that down. It originates on the anterior surface, superior of the iliac crest, anterior superior iliac spine, and it comes all the way down to the medial aspect of the tibia. Pes anseralis. It comes across, and it helps you to bring your leg up and lay your foot on top of your other knee. They call it the Taylor's muscle because back in the days when people were actually sewed suits and things together by hand, they created a platform for their work. By putting their leg up like that, it made an area to put their sewing on. They wouldn't fall on the floor. So they call it the Taylor's, or the sitting muscle. So if you're going to do like cross-legged or sitting with your legs crossed, we used to call it Indian style, but that's not politically correct anymore. So that's the Taylor's muscle that does this. Gastrocnemius is the muscle in the back of the leg. What's a good way to strengthen your calf muscles? Got a good exercise?
Running.
Calf raises.
Calf raises. So you go out and pick up a calf and lift him up?
Yes.
That kind of calf? No, different kind of calf, right? So here's a question. If you have a baby calf and you go out and you can pick him up and you pick him up every day and you do it maybe 5-6 times a day, can you continue? Will that make you strong enough so that you can pick the cow up when it grows up?
No, you can never put the cow on.
But
Well, you could, but
you're doing it every day, though. I mean, shouldn't you get stronger as they get stronger?
no.
How about mothers with their babies? Does that work with them?
They eventually get too heavy. You're like, yeah, better learn to walk.
If you have a 9-pound baby, or let's say a 7-pound baby, you pick her or him up every day. Do you get stronger so that you're more used to it?
Get stronger of 9 pounds, but nothing more.
Boy, he'll turn 10 pounds next week.
Okay, then you'll get stronger than 10 pounds.
So you won't be able to lift them though, because you're only ready for 9 pounds.
Yeah.
You'll struggle a little bit, but eventually it'll become normal again.
So if you have an 18-month and they're 24 pounds or whatever, if you haven't had a baby before, could you pick them up and carry them very easy? No, you want to see, we kind of adapt as we go along. You start with a 7-pound baby, but within months, it may be 20 pounds, so now that's nothing. You can lift that. But if grandma comes over and tries to lift a 20-pound baby, you go, ugh, I can't do it, right? They're not used to it. So we do get used to it a little bit. Gastrocnemius is in the back. This is the calf muscles. Originates in the femur and inserts in the dorsum of the calcaneus by way of the Achilles tendon. Achilles tendon goes down to the calcaneus. Soleus muscle is underneath of it. It helps also with one of this, as part of this leg muscles. They form the triceps seri muscle, they call it. Originates on the posterior surface of the head of the upper shaft of the fibula and inserts on the dorsum of the calcaneus by way of the Achilles tendon. We have the fibularis muscles, which we used to call them the peroneus muscles. We have the brevis, longus muscles. Those are different ones. This is the ones that are affected when you twist your ankle. It stretches them out, damages those muscles on the outside of the leg. Originates on the lower 1/3 of the fibula and inserts on the tuberosity of the 5th metatarsal. That's why I asked you on the test which one was the 5th metatarsal of that. Now you know where that hooks. So if you twist it really hard, you can pull that 5th metatarsal out of place, or you can actually tear that muscle off that bone. Fibularis peroneus longus, it's a little bit longer than the others. Upper 2/3 of the lateral surface of the fibula. It courses down and goes underneath the foot, and it inserts on the 1st metatarsal bone. Extends and plantar flexes and everts the foot. Pulls the foot outward. Fibularis tertius, distal part of the anterior surface of the fibula, courses down the side of the leg to the dorsum and shaft of the 5th metatarsal bone and everts the foot. Then we have the tibialis anterior, a muscle that goes right along the shin. This is, you crack your shin, this is one that can be painful. Originates on the lateral tibial condyle and inserts on the medial surface of the cuneiform. Dorsiflexes, brings the foot up and inverts it, rotates it inward. To counteract that, we have to have the tibialis posterior, or posticus. Goes down the back of the leg, originates from the interosseous membrane, inserts on the posterior medial surface of the fibula. Goes all the way down, and it plantar flexes the foot and everts the foot. Inverts the foot, just like the others. It's an antagonist to the anterior bones. Then we have the flexor digitorum longus, just like in the hand. It flexes the toes. You're flexing your toes, you're gripping. Some people can grip. I have a friend of mine that can throw a frisbee with his foot. He can grip with his big toe and and throw a frisbee and pinch with it. Originates in the medial half of the posterior surface of the tibia, and it inserts then on the distal phalanges. Flexes the toes. Then we have extensor digitorum, which extends the toes. The lateral condyle of the tibia, and inserts on the dorsum lateral 4 toes. It helps to pull the toes upward and back. Extensor hallucis longus. What is hallucis? It's another name for it, hallucis. Where do we find the hallucis at? Big toe is a hallucis. Very good. Medial half of the anterior surface of the fibula and inserts then on the big toe. Extends the big toe backwards. Last 4 muscles, promise. Quadriceps, rectus femoris, vastus intermedialis, vastus lateralis, and vastus medialis. 4 muscles. So where are the areas that we give shots? We talked about this the other day. Where do we give a shot at?
The arms,
Your
legs,
deltoid,
Arms, legs, and butt, right? So what muscles are they though?
your deltoid, your gluteus maximus, and your, what else did we say?
the
Legs.
legs.
So those.
So one of these muscles here, right? Rectus femoris has straight. It has a straight head, and it has this reflected head, which is kind of an inner way. So looking, it's down below. It inserts on the patella and the tibia, all the way across to the tibial tuberosity by way of the plantar ligament. Common plantar ligament extends the leg and flexes the thigh. Helps you bring your leg up and points your toe, like you're kicking. So quadriceps are good for that. Vastus intermedialis originates on the anterior and lateral surface of the femur. Inserts to the patella, just like the other one, and it extends the leg. Vastus lateralis originates on the lateral intramuscular septum and the gluteal tuberosity, and it inserts on the patella and the medial plantar retinaculum. Extends the leg. Medial intermuscular septum of vastus medialis extends the leg and it hooks to the patella, just like the other quadriceps muscles does. And that's it.